for affordable cardiac care. And let me take this opportunity to introduce my array of speakers for this very important session. For this session, I have with me Dr. Ashish Malhotra, who's a cardiologist. Dr. Ashish, welcome to the discussion. Next, we have Dr. Mangesh, who's a senior cardiologist at Dr. Babasaheb Ambedkar Memorial Hospital, Byculla. Dr. Mangesh, welcome to the discussion. Next, we have Dr. Shishir Raul, who's an interventional cardiologist at Jagjeevan Ram Hospital, Mumbai. I welcome all of you to this very important talk session. So, coming to you, Dr. Mangesh, when we talk about the Indian government, which is doing a lot of, initiatives are being implemented, especially when we talk about non-communicable diseases. Dr. Mangesh, are you able to hear me? No, you need to unmute yourself.
Yeah, fine.
So when we look at all those initiatives and the present scenario when it comes to cardiovascular diseases, what is your take? What is the overall overview that you can, talk about?
In a day-to-day practice, we see lots of patients from when we see adult patients, right from majority, we see coronary artery disease related patients like heart attack patients, usually we see. Along with that, we are seeing valve related pathologies also. Like previously in older era, we used to see valve related diseases like rheumatic heart disease more in a adult population along with children also. But nowadays that percentage has come down, and now we are seeing more like non-infectious diseases like calcified valve diseases, which because of the increased life expectancy and healthy lifestyle habits, we are seeing these patients in a more category. But considering in our Indian population, which is showing many risk factors like Interheart study showing 9 risk factors majority, which we do harbor, including like physical inactivity, low intake of fruits, vegetables, also psychological stress, which accounted more than 90% of the heart attack in South Asian population. And that is why we see increased cardiovascular death rate in India, which is approximately 272 per 1 lakh population compared to our global counterpart, which is 235. So it is obviously on the higher side. So we do still see such patients in a rise. Not only older patients, we see young patients also nowadays. At the age of 45, 50 years, we see patients getting heart attack, and we do treat them. We see what is the major risk factors in young population. Surprisingly, the smoking. Smoking is, though with the government initiatives, we can see hardly, one study is showing that there is a 6% decline compared to 95 to 17 with the smoking cessation strategies what government of India has applied. But still, smoking is the single largest modifiable and reversible risk factors, I can say, to prevent this cardiovascular disease. Hello. Hello. Hello.
So we can hear you.
Yes. Yes,
Yeah.
yes, sir. Thank you for those insights. Dr. Shishir, coming to you, like we have recently seen, like Dr. Mangesh also pointed out how, cardiovascular diseases have emerged as the topmost killer when it comes to, and now we even see that the age factor is there. We see young people, 40, 45 getting impacted. So you think there is, when we talk about risk factor, lifestyle changes, you think there is a direct, impact when we talk about these increasing instances?
Hello, am I audible? Hello,
Yes.
am I audible?
Yes.
Okay. Okay, good evening, everybody. So far as cardiovascular disease is concerned, we have divided it two groups. One is modifiable, one is non-modifiable. Modifiable in the sense, what we can modify with our behavior and with our lifestyle. And non-modifiable, the genetic disorder. For example, if the parents is having hypertensive, diabetic, or cardiovascular disease, I may get a chance. Some risk factor and ethically, and some patient who is having black color and white color like that. So there's some modifiable and more importantly non-modifiable. For example, one is your age. The moment we are becoming older, we are getting chance of cardiac disease or hypertension, diabetic. So there's some modifiable risk factor. The non-modifiable, as I told, age, sex, male person are getting chance of more cardiovascular disease, hypertension like that. And for example, female after the menopause, and some black person and some Asian non-ethical like that. And non-modifiable, as Dr. Mangesh told, so there's some non-modifiable risk factor in the sense hypertension, in the sense smoking, obesity, coming to your controlling your dyslipidemia, controlling your obesity, your weight, blood pressure, diabetes, and more importantly, your stress. Taking so that we usually we tell 7S you need to know. 7S. One is your stress, salt, then sleep, adequate sleep, then sedentary life, then your saturated fat like that. So the one 7S which also take care of your modifiable risk factor. So as Dr. Mangesh told, so when you are dividing a cardiovascular disease, what we can control and modifiable risk factor 80%. 80% are modifiable. What can control? What we can prevent the heart disease? So far as cardiovascular disease is concerned, we should take care of our health. We should take care of we should know what is our BP, what is our blood sugar, what is our weight, what is our cholesterol, what is our exercise, daily exercise, so and so. So we should take care of our modifiable risk factor and more likely as to the smoking, you should smoke. No question of smoking in the world so far as the health is concerned.
Yes. Coming to you, Dr. Ashish Malhotra, when we talk about accessibility and affordability, which was a major issue, but now with so many government initiatives which are working at making healthcare, ensuring health equity. But when it comes to rural sections of the society, we still find that, there are certain challenges, and awareness being one of the, most important thing. So what have been your experiences when we specifically talk about rural sections and how accessibility, has been one of the major issues? What are some of the other challenges that, you can think of in your practice as a cardiologist?
As far as I am concerned, I am an intervention cardiologist, which has been launched. I have done many cases of angioplasty which used to cost more than 1.5 to 2 lakhs before. And many of the patients, particularly those who are below, most of them we are doing them free of cost. Free means Ayushman scheme in the hospital where I am attached. So many, particularly rural population and below, and we have done their angioplasty. Many of the patients are still not aware, and we have to make them aware that such a scheme exists, and you can definitely utilize this scheme. And whenever the patients are referred from the rural areas, then they come to us and then we convince them that you can get of that. So it's a very, very useful scheme, and many poor patients who could not afford the treatment like angioplasty, they have benefited from that. The scenario has changed in the rural areas now, and most of the district hospitals and primary health centers have now got ECG machine, and many of the doctors there are also now well aware, and they can read the ECG, and many times we get the WhatsApp of the ECG, and on emergency they refer them to us, and then we get them angioplasty done under the Ayushman scheme. So I think this government initiative is very, very important for the rural population. And if the further awareness is done by the education and awareness, more and more patients can benefit from this scheme. Anything
Yes.
further you want to know?
Yes, yes. Thank you, Dr. Ashish, for that insight. Coming back to you, Dr. Mangesh, like Dr. Ashish already pointed out, how awareness is a major factor, because many people are not even aware of, the schemes and what perks they are getting. So in your practice, what has been some of the successful, endeavors or initiatives that you have seen actually, at the ground level working wonders in creating awareness, for accessing medical care at the right time?
So with the advent of smart technology and this smartphones, we are now able to reach many of the unreachable population. Previously, we people used to hesitate and to go, but with the with the now the increasing patients load, patient are aware ki what exactly they want, and they know now. They are more educated. They nowadays they directly go to the major hospitals, but many a time rural population is not that fortunate to take that advantage, and they need to go to doctors in the rural areas. So what option they have? The rural area doctors can get use of this telemedicine, with the advent of this, as now the sir said ki the doctors can send ECG on WhatsApp, and how they immediately diagnose whether patient is in critical condition, whether patient has a heart attack or no, and they can immediately refer appropriate patients, and immediately the treatment can be started. Likewise, there is a major role, and what we can do, like we can put signage boards or something like that in our hospitals, vividly visible to all population, so that they can take use of all these facilities like Ayushman Bharat. In Maharashtra, we have Mahatma Phule Jan Arogya Yojana. For those poor people, you can get advantage of 5 lakhs of benefit for their admission, and that can help them really treating and get proper treatment. Likewise, so what I feel is we are doing as a railway to give everyone free of cost treatment irrespective of their rank and cadre. But for general population, if we consider, likewise in government hospital also, there are many good schemes going on which can cater these patients and give them a appropriate treatment from cardiac point of view. Yes.
Yes, thank you for that. Dr. Shishir, coming back to you, since Dr. Mangesh also talked about how, financial burden has in a way decreased on the vulnerable sections of the population. But you think there are certain, when we talk about government funded programs, so do you think as your, since you have worked at that level, you think there are certain gaps that you would want especially when it comes to government funded schemes, that you would want the government to address proactively, that you have seen in your, work as a cardiologist? What are some of the areas that you would say need further attention?
Let us take a bright example. Recently, we had COVID. Government took all the activities on ahead, go into the research, go on and all the best possible way to help all of us, free vaccine like that. So this is the bright example. I mean to say, government has enough, not only manpower, not only monetary, it can attract or it can affect anybody. I mean to say, for example, giving subsidy in the med. For example, initially, as sir told, initially the stent was 1,000, 1 lakh. Now it's come to 30, 35, for example. For example, the subsidy with the emergency medicine. Now they have come with knee and heart and hip replacement. So this is one, giving subsidy. Second, coming with insurance. For example, giving insurance, as Dr. Mangesh told, like Aishman Bharat to the poor people particularly. So that also can, if they are more, and going on PPP mode, and going to primary health center, educated more primary health center we can have, and accessibility all the poor people, and even if normal people to go there and have education, and safety and price regulation. More importantly, for example, I went to a private hospital, they charge this amount of money to me. Whether that was justifiable or not, somebody has to control body to there, whether they are the private person, a private hospital is actually charging the right amount to the, because there are some malified intention, and then some mischiefs are occurring there because they charge something wrong or something more. And more importantly, most importantly, that the awareness we should have. I want starting from the school, college, everybody and everything. They should have what is, for example, cardiac, where the you can think of a cardiac element is there. What are the symptoms, sign symptoms of the, and if you get symptom, what should do? There should not be any stigma or hiding. If I got diagnosed a cardiac problem, that will be a stigma to me. Or if I diagnose a case, I'm having a CABG or bypass or a cardiac problem, nobody, the ladies will tell, yeah, I get some valvular heart disease, nobody is going to marry me. Or if I get a rheumatic heart disease, there will be a stigma like that. So that part has to be clear cut, and there should be abolish of any misconception and misunderstanding of the health disease. Health, whatever, when there are so much so advantages in the hand, so now which was not curable, now it is a curable disease. So awareness, more importantly, and some subsidy in the most element, the important medicine, whatever, health education, then preventive aspect, research, what I told, research, and more importantly, and like price regulation and healthcare education, like that. As I told, we might should have a telemedicine, like we can approach each and every part of corner of the country. Anybody sitting in the house can ask a question to a cardiologist or anybody who is well qualified with the mobile or WhatsApp, so they can have.
Right. So, Dr. Shishir rightly pointed out about the PPP model, how public-private collaboration can, give better health outcomes. What is your take on initiating? And then, of course, when we talk about awareness creation, so how can private entities, work towards better collaborations, which can, in the long run, give better health outcomes?
Yes, as rightly pointed out by Dr. Mangesh and other doctors have. It is very important to have the public-private partnership. Government cannot go on opening hospitals all over the country in each and every nook and corner, and most of the patients who first contact is with a private hospital because they are readily available in each every locality, each residential area. The hospitals are available. So government should have, like the Tamil Nadu, they have created a 4-tier center. The first point of contact, the first hospital, and primary care hospital, secondary, tertiary care hospital. So the health scheme or the Ayushman scheme should be linked with all the private hospitals. And whenever the patient comes in a cardiac emergency, particularly acute myocardial infarction, immediately the ECG should be uploaded on the website, or there should be some central monitoring system. And when the ECG uploaded, immediately the nearest hospital which is offering the Ayushman Bharat or the other government health scheme they are entertaining, the patient should be immediately ambulance in our state. Whenever the emergency, immediately the ambulance, fully equipped ambulance comes with the defibrillator monitor oxygen, etc., and patient is immediately transported to the tertiary care hospital. And all the private hospitals, even small clinics which are having ECG machines, should be connected to the central where they can upload the ECG immediately. Immediate action is taken because, as in a heart attack, the time is muscle. Every minute, every hour is most important. The earlier you open up the artery, the more the better is survival, better is the left ventricular function, less is the morbidity in this type of patient. So it is very, very important. The patient should be immediately rush to the nearest tertiary healthcare center where he gets the best possible treatment. And now, because of government initiatives and subsidies, the cost also is negligible to the patient, and in fact, mostly it is highly subsidized and almost free. So the awareness should be created in various educational, in the media, as well as the Lions Club, Rotary Club, other rural areas in the panchayat and other areas where the rural population has access, and then they should be told how to contact the doctor whenever they have, say, chest pain. They should take the ECG. Where is the ECG available in that particular rural area? Immediately upload it on the central website, and then whichever private or public hospital is offering that service, the patient should be immediately referred, and this can definitely save the life of large number of patients rather than they going here and there and getting confused and wasting valuable time, because every minute, every hour is important when you manage an emergency like an acute myocardial infarction.
Right. Dr. Ashish very rightly pointed out, awareness is the key. Dr. Mangesh, coming to you, when we talk about educational campaigns, awareness sessions, like Dr. Shishir also pointed out, how there is a lot of myths and information, misinformation related with health, and heart being a very important key aspect of overall health. How you think how can we create more impactful, awareness when we talk about creating it at the ground level? You think there are certain gaps that we need to address, because there are a lot of with health, there is a host of information there which is there. So how do we ensure that the correct information reaches out through proper culturally sensitive information? How do we ensure that?
Right. Nowadays, we see lots of messages popping up on social media, and not only like somebody says, ki, if we eat this, this is better. If we do some exercise, this is better. So there is no control of this information what is being circulated over that social media. For that, I would request that government authorities to, before these messages or this information which will impact our health in a major sense, should be screened, or there should be some authority to have a watch on these circulation of messages, or post like video posts, something like that, so that only those authorities will be in a control to say ki whether these informations is actually correct or no. Otherwise, there are so many people just create some channels, and they just circulate for just sake of publicity. That should not happen actually. But what I can say, ki there are certain ways which can government can do, like first is protecting these people who have got that is a fundamental right. Article 21 of our Indian Constitution says there is the fundamental right to life. That is Article 21 says. So any patients who has got in an emergency, like maybe due to heart attack, in any situation like an emergency, so he should be provided the necessary care at emergency place, so that availability of his treatment at free of cost, basically emergency treatment at any government hospital, irrespective of whether he's okay, his relatives are there, whether he's paying, not paying, he should be attended without any hesitation, like without any fear of any police or anything like that. Second thing, this should be made a law properly. And second thing, offering help to these people who have got the heart attack by, as Shishir sir said, ki by subsidizing, treatment medicines or like stent or procedure cost. They have already done in CGHS, but still, if they can revise and do anything for these patients. So again, they can do warning about these warning signs should be inculcated in colleges only, like harmful habits of smoking, alcohol and all should be made a part of syllabus of this. There it is obviously, but it should be more enforced in a more proper practical way, so that our young generation should be aware ki what are the signs and symptoms of these diseases, how we can recognize not only for themselves but in surrounding also, in environment also. How can they get a help, like teaching CPR to each and every individual is must nowadays, because we may not know who can collapse at any point of time, and doctor may or may not be available at that point of time. So the nearest person is the key factor who can resuscitate him and get him to the nearest available medical facility. Second thing, we can enforce ban on like tobacco, alcohol, not only for advertising ban, promotion of their and sponsorship also of these tobacco okay products should also be banned from the government point of view. And second, the hardest thing what they can do, they should raise more and more taxes on such products, so that people will hesitate to okay get into these practices. That's what. And otherwise, what you asked me ki, is what we can, how can we control this information what is circulating in media. What I personally feel, there should be some task force okay appointed by government, so that they go through these messages or those videos, and then they should make them answerable, responsible for this. Unless they have some data, they should not just circulate anything and whatever they feel like, that which is related to their patient's health or something like that. So that's what I feel. So
Right, right. Very rightly pointed out that awareness is a very important factor. Coming to you, Dr. Shishir, when we talk about, recent advancements and how the whole, cardiovascular care ecosystem has evolved, like we have seen in the last decade, how digitalization and everything has become an important part, and it has actually changed the whole scenario. When we talk about the future, what do you think are some of the technologies that can help bridge the affordability gap? Where do you see the whole care and management when it comes to heart health? How do you see it growing?
Okay. Okay. What you are telling is a treatment aspect. More importantly, if somebody got the disease, right, the how you can have the easy accessibility or most technical treatment. Before that, let me have something about how somebody can guess something wrong is happening with him, or what are the I can tell what is the barrier I can take. For example, lack of awareness. If someone does not know what is the how the heart can react badly, or how what is the maybe the end result of heart attack, like that. For example, if somebody got the heart attack, still he does not have money, so that is a financial crisis. Even if he does money, does not have a nearby good hospital where tertiary care and the heart care facilities. Even if somebody does have heart care facility nearby, still there is no proper transport. There is so much rush, and for example, traffic jam and like that. Even if there is traffic jam, if he goes to that, there will be something misbehavior in the form of they will charge like anything, and there is no proper doctor, well educated, well experienced cardiac surgeon or cardiologist is not available. And even if that after all that, at the end of the day, we can make having everything with us, we can lose. So more importantly, so far as advantage future advance is concerned, so we have to have preventive aspect more important. We have to diagnose before a major thing has happened or major output to come. We should. So no cardiac, for example, not a single time somebody will have seven blockage in the artery. I mean to say. So it starts with single, that will not taken care. Then subsequent go ahead. For example, leaking of a valve, mitral valve. For example, there is mild MR. Somebody is having breathlessness. It does not take care of that. So subsequently come with a severe MR or severe aortic stenosis like that. Now the science and the everything has gone up. For example, from open heart surgery, now we have come into minimal heart surgery. From femoral angioplasty, we have come to the radial angioplasty. From no stent to no stent, for example, now we have come with valvular heart in transcutaneous aortic valve replacement. Any valve we can now all the cardiac surgery part is taken by the cardiologist now. Now even robotic surgery has come up, and now the more importantly, the medicine has so much has gone up with its potency. There will be chance of getting stent thrombosis is less, start of getting recurrent heart failure, stent valve surgery is less, and the best drug-eluting stent and the better medicine and the items we have come up with. So more importantly, that will the one that there we may have or more advantages. There may be a stent platform fee, or there will no stent, only drug we can put like that. Whatever we can have a pig heart in a human heart and robotic surgery like that. But more importantly, most importantly, what we can do at present, awareness. So we should know what is wrong with us, and more importantly, what we should not do. There are two aspects of the disease. One is given by the God, one we create. What is God has given, we should smell something wrong which has been, and what we should not buy the disease, we should not smoke. If want to die, then smoke. If somebody want to die after 10 years, 15 years, then he'll have smoking, alcohol, excess alcohol, lack of exercise, and physical inability, stress, and more importantly, dyslipidemia, and smoking, like that. So what will happen in future, that's okay. What we should do, we should take care of our preventive aspect. We should know what may wrong we may have, and more important, as you are discussing with PPP model, whatever best available there, we should have a. If I can order a pizza within 30 minutes, if I can get a pizza within 30 minutes, why not I get a stent or angioplasty within 30 minutes? That's my point.
Right, very rightly pointed out, Dr. Shishir. Coming to you, Dr. Ashish, how do you see the future of cardiac care evolving in India? And what are the key areas that you think they need attention from both? One, Dr. Shishir has rightly pointed out about that move from treatment to preventive approach. And so, what is your take? Like, how can healthcare providers and policymakers work together to improve patient outcomes?
As far as healthcare in India is concerned, it is easy to treat the population, those who are already having a lot of money. It is not a problem. Several tertiary hospitals are now available. Those who can spend the money, say 4 lakh, 5 lakh, 10 lakhs, they can get easily the angioplasty, everything done. Problem comes of the rural population and those poor people who are not able to afford. Because India has now become the diabetic capital in the world. Every third, fourth person is now having diabetes. Diabetes is a disease which doesn't spare the arteries of the heart, and even person doesn't know the arteries get blocked. And even the rural population where they used to do lot of hard work, but now even rural population, everybody is having motorcycle, everybody doesn't want to work, they are eating too much, and the hard work they are not doing, the physical activity has come down to a lot. And because of this, the even rural population and poor people are now having heart disease and heart attacks. So what we require are highly public-private partnerships, the special hospitals which are catering to those, say 5, 10 or 20% population. Those who are affording, they can get the treatment at the affording rates. Those who are poor, they require either government subsidy or they require subsidy from some philanthropists or industrialists who can support them. For example, this special type of hospital recently I visited in Chitrakoot Eye Hospital. In this hospital, all the eye surgery is totally free. They are doing 4.5 lakh surgeries per year, and out of 4.5 lakh, around 30,000 surgeries are those patients who can afford, and rest of the surgeries are done totally free. But that doesn't mean that the hospital is substandard. The hospital is very highly equipped hospital. They have got 26 modular OTs and the latest equipment. Even the big eye surgeons or the best eye hospitals are not having. But they are having all that equipment. They are being funded by various societies in Gujarat and Mumbai, and Mafatlal Guprov Industries as the director, and they are getting a lot of subsidies. Plus, they are also training the students. They are also post Masters of Surgery, MS Ophthalmology students are also being given opportunity to get operative experience there. So they are motivated. So there are more than 150 MS Ophthalmology doctors there, and almost 20 to 30 they have got the senior consultants. So that is how they are doing a huge number of operations in that particularly rural area of Chitrakoot, which is very difficult to reach. So if you want to go to Chitrakoot, which is on the border of Madhya Pradesh and Uttar Pradesh, it's very difficult to reach that area. No flights are there, and even the nearest flight is Allahabad, but still you can reach there. So these type of public-private hospitals are required, and when we can get the public-private partnerships, and now large number of cardiologists are getting, after the government recent union government has scheme, they have increased the PG seats, and large number of cardiologists are being produced every year, and so we can have this type of large hospitals with public-private partnership. Doctors can work there and then cater to the large number of hospital, and even now they don't have to do totally free. Even the government is giving the Ayushman Bharat scheme, and more 5 lakh
Right. I think there is some connection issue at Dr. Ashish's end. I'm not able to hear him.
and humble submission to the government and the various industries to combine together and then open large number of such hospitals for catering to the poor people.
Yes, thank you, Dr. Ashish, for that. Coming to you, Dr. Mangesh, since we are, short on time, I would just ask you, we have talked about how awareness is important, PPP model should be there, how, especially the vulnerable population needs to be included, and it needs to be ensured that health equity is there when we talk about overall health. And so coming to you, Dr. Mangesh, your key takeaways when we talk about, government initiatives for accessible and affordable heart care in India. What would be anything that you think we have missed out on, you would want to add to the whole discussion?
As in, when government is nicely doing their part, but as we from a private sector's motto is a curative treatment, and government sector is not only curative. Government sector is involved in research and more in like a preventive aspects. So private sector, they set up a tertiary care hospital, they will treat the patient, and government not only has their responsibility of treating, but if they put more of their resources into preventive aspects, their ultimate burden of curation or treatment will come down. So what I feel, more and more policies of government should be centered towards preventive aspects. Okay, and that's what government also may be doing. There are so many programs of governments going on. For that matter, just now Dr. Shishir was sir said ki government is already utilizing this advance of medicine like telemedicine, how it is used right from actually in 2001, ISRO started with use of this telemedicine. Our Indian Space Research Center, this organization started this in 2001 with Apollo Hospital, and it has spread in so many parts of the India, so that there are IDSP, OncoNet, means almost many of them national medical colleges are connected through internet facilities, so that they can share and discuss each and every their cases. They will come to learn each and every aspects. Now that Arogya Shri program of Government of India is through mobile internet services. They have actually combined multiple hospitals with many specialists and rural clinics also. This is actually initiated by ICMR project. So government is doing their part, but and this is in the curative aspects. But what we need to see more and more in preventive aspects. We would like to see government putting their more efforts in preventive aspects, so that the tsunami of this CV disease in near future, what we are expecting, as we are the most populous country nowadays in a number world, so that we can control that in near future.
Right. Dr. Mangesh very rightly have pointed out how we need to include preventive approach in the main discourse of things. Dr. Shishir, coming to you, what would be your major takeaways for the session, and anything else you would want to add apart from what all we have discussed?
As I was telling, I started with the disease, two things. Disease is something in my God, something we create, something modifiable, something non-modifiable. What is non-modifiable, we should not take care of, we should just give to respect. What is modifiable, we should give respect. I mean to say, for example, there is a talk why the Amitabh Bachchan was told, do bun zindagi ki. Kyun usko polio, why he was given the chance to advertise polio? Because there is a term, we respect much more. We learn much more from them, to whom we respect much more. I mean to say, if somebody as a stature of dignity, I mean to say, if my parents, my father tells something, I take it, it's okay, right. So if I'm going to have some awareness program, so to whom I'm telling, they should respect me, they should have faith on me, they should have a lack of, they should have trust on me. Yeah, this is Dr. Sisi, what is telling, right. As Dr. Mangesh telling, if somebody will say, don't eat this, nobody is going to listen. If somebody have trust on me, yeah, somebody have respect on me, somebody have a, what I can tell, belief on me, they will accept me. So the government should choose and should, form a system, or form a committee, or form a group of person to who they are respected. But and once what they saw, okay, this is like, I mean to say, so far as disease treatment is, so always prevention is better than cure. And 80% of the cardiovascular disease we can prevent. What a huge amount we can have. And that it with our heart. If I can smile with my family, if I can spare a good time with my family, if I walk with my family, if I can eat a healthy diet with family, if I do never think of smoking, if I have a good 7 to 8 hours sleeping, and if I control my weight, my BP, then some 80% of but I may be disease free. So that's the key message. Okay, preventive aspect, treatment aspect, as Dr. Ashish was telling, because it is even if I get a disease, I may not be in a position to get that much of money to get my treatment. Even if rural area, don't think of that. They cannot get, even before 80% of the MI patient before reaching hospital, they die. Cardiac arrhythmia, whatever the death were occurring before they reaching the hospital, they're dying. What the worst we can think? We are reaching at the moon, but we are still not giving only tenecteplase to the hospital. Even we can give a thrombolytic agent in the ambulance, and in the right time, getting an ECG, or even if we do not have a AED in a colony, in a sports, some person are going to the gym and they are going to die. They don't know when not to do, what amount of exercise they should not do. There is no facility of AED, and we are reaching at the moon. So I mean to say, preventive. Prevention is more. Whatever you are going to give treatment aspect, there will be a lag, because so much population, we may not be in any position, even if all PPP mode, even if we are not treating malaria properly, we are loose motion diarrhea patients are dying like anything. Think of the cardiovascular disease. So prevention. That's it.
Right. Very rightly pointed out, Dr. Shishir. Coming to you, Dr. Ashish. your major takeaway for the session. Anything you would want to add to the whole discussion?
Yes, as Dr. Shishir has rightly pointed out, and as you have also pointed out, that awareness and education is very, very important. Every person in the society should be made aware what are the good practices, that is, weight should not increase. After a particular age, he should get his blood sugar, high blood pressure, cholesterol checked. That should be well controlled. Smoking and other alcohol should be tobacco products should be totally avoided. Some amount of regular exercise is a must, and this should be emphasized. This is lifestyle modification is a must. And in spite of someone gets some problem, then of course there is a very high cost for the, at least for the local person, or the ordinary person on the street. Not for those who are affording. The other person, it is impossible to spend such a huge amount in such a short time. And government has done a very good thing by the Ayushman Bharat scheme, and a lot of patients are getting benefited by this scheme, particularly below poverty line people. They should be made aware that such a facility exists even in this type of emergency. And if we can do both at the primary level, education level, and plus we make them aware that even if the emergency is there, they can avail of the scheme, then we can do a great service to the society and help them to attain a better cardiovascular health. Thank you.
Right, Dr. Ashish. That sums up the session, and I sincerely hope that our audience take away a lot of relevant awareness on preventive, lifestyle for good heart, and how government initiatives are working around non-communicable diseases, playing an important role in this stride towards a more accessible and affordable, health equity, and with focus on cardiovascular health in the country. And thank you so much for taking out time from your busy schedules and joining our session. Dr. Shishir, Dr. Ashish, Dr. Mangesh, thank you so much for joining us. And thank you for being there.
Thank you.
Okay, thank you.
Thank you.
That was all for today. We'll see you